When the first signs of COVID-19 outbreaks in Australian aged care facilities emerged in March, it quickly became clear that the vulnerabilities it was exposing were not just those of the frail elderly, but of the system itself to the inherent weaknesses of its workforce.
One of the new cases involves a woman in her 50s who works at Dorothy Henderson Lodge in Macquarie Park.
Claims quickly emerged that on one night, after the first positive cases were revealed, most of the staff rostered on at Dorothy Henderson Lodge had called in sick, the shift covered by our work hire agency. The staff were, understandably, concerned about endangering their own family members. But the crises that emerged demonstrated broader problems in the aged care workforce, and particularly its capacity to deal with a pandemic. It has long been known that the workforce is woefully paid, and there are no minimum training qualifications. So it should not have been a surprise it was not prepared for a pandemic. The Royal Commission into Aged Care is to hold a special sitting next week to look at lessons to be learned to date from what has happened. But in the meantime, as Victoria reported another 11 COVID deaths in nursing homes today, a Senate committee was seeking an explanation from the Federal Minister and health bureaucrats as to why the early tragedies in aged care had seemingly failed to kickstart preparation for future outbreaks. The committee particularly honed in on what had happened in St Basil's Home for the Aged, linked to 139 infections.
So there was that 5-day window where the Commonwealth had no line of sight, no understanding that there was an outbreak occurring in St Basil's.
Correct. The challenge was with the huge and overwhelming amount of community transmission, the Victorian Public Health Unit had some delays in both getting tests back, analysing and identifying that this was an aged care outbreak.
It's become clear that the system was also underprepared for situations where a particular home suddenly finds itself without a workforce, even though there have been cases of this before COVID with disastrous results.
We have a situation in Victoria where every health and aged care service and related services where we might find a ready workforce are under pressure because of the community transmission. And there is some real limits to the identification of a replacement workforce, and it's unique to the situation we have in Victoria. All the plans in the world are not going to help you when you get to that situation.
The Health Department has been rolling out crash course training on the basics of infection control for aged care workers, mostly delivered online.
In terms of infection control training, it seemed to me the uptake of the online processes were pretty low.
Senator, the take-up has been very good. The completions, are in excess of 100, for most of them, in excess of 100,000. We can give you a table of this.
That's 100,000 out of more than 360,000 aged care workers in Australia. So that's still less than 1 in 3 who have completed infection control training. The inquiry also heard changes had been made to ensure relatives of infected people in aged care are not left in the dark, as has happened in a number of cases so far. But a request to put the list of homes with outbreaks on the public record was denied. The Morrison government activated an aged care response centre in Victoria 2 weeks after the first cases were reported. While it may have not been informed of the St Basil's outbreak for 5 days, the picture continues to be of responses still being too slow, as well as a system unable to cope.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.